Good evening, guys. I know it's pretty late over there in Nairobi, but I'll try to keep this as short and sweet as I can. I know guys have a lot of questions, so we'll have an opportunity for everybody to ask some questions at the end. I guess I'll just take you guys through the better part of my career. And if I miss anything, there's lots that I might miss. Feel free to ask any questions or poke holes to my talk or discussion. It's very open. Okay, so I'd like to just start with a quote from a poem that I like, that I feel like resonates with different points of my life, and probably will resonate with you at some point, if not now, then later or in retrospect. The specific bit that I like is, it says, and at the end of our exploring will be to arrive where we started and know the place for the first time, right? And I'll get back to this at the end of the presentation, just to see whether we can circle back. So this is myself and a couple of my classmates back in 2012 when we graduated. So back then we were doing 5 years of med school. After the 5 years, you're so excited, finally a doctor, but you have no idea what awaits for you. So I did my internship in EMBU, level 5, and I spent 10 years of my life since then, since a graduation in EMBU. I honestly didn't think I was going to spend that much time there, but somehow that happened. So this was sort of like day one into welcome to EMBU, welcome to Mashinani. How I chose EMBU as an internship spot is not really an interesting story. I was looking for somewhere that's not too far from Nairobi, but not too close. Wanted to get some of that rural healthcare experience, and EMBU, guys just didn't know about EMBU. I think up till now, guys still think EMBU is a place before Meru, and not much has changed. But it was an interesting spot to start my internship. Day one of internship was as traumatizing as internship can get. So usually what happens is you have another group of interns who have consistently worked for a year, 365 days without any leave. And so when you guys get there, it's a fast relief for those guys. So what happened is we were just two guys in my rotation, myself and one of my colleagues is called Dr. Msao, he's in the previous picture. We get into PEDS, which was our first rotation. Last time we had done PEDS was in 4th year, so it was like a year plus with no PEDS experience. We get into the PEDS ward, the outgoing PEDS MO interns welcome us and immediately leave. So now we're left alone to our own devices. And in like the first 10 minutes, one of the kids in the PEDS acute room gets into cardiac arrest, and we have to resuscitate the kid. I had no idea about the resuscitation protocols. It had been so long since I did my ETAT. So we rush into the room. Msao is holding the PEDS protocol, that small white book, and is reading out the protocols to me as I'm trying to resuscitate this kid. And we go on for like the next 30 minutes. Unfortunately, the kid didn't make it. And that was like day one. It was pretty traumatizing, honestly. And as time passes by, you get better at like acute emergencies, but you get to realize that there's a problem in the healthcare system and there's a problem in how we deliver healthcare, and such things should not happen. You should not be left alone without supervision in day one to manage a whole ward with like 50 admissions, and you have like memory in your caudate pinna, so to speak. Yeah. So essentially this was sort of like reality is on the left, versus what your expectation might have been when you're becoming a doctor. Yeah. And what I learned pretty quick was my passion in medicine stemmed from a point of wanting to make a difference. And I felt that I would be able to make a difference if I stepped away from the stethoscope, got into healthcare management, and tried to establish a healthcare facility that would be able to deliver the type of care that I felt people should be getting. So it took me a couple of years, convinced some of the guys that you saw in that initial picture for us to set up a medical facility together. And that's when the idea of Imara was born. So it was born at some point in my internship. At the end of it, got guys together. We were 5 doctors who co-founded Imara, started as a clinic, and essentially built from that. It wasn't an easy start for, this is some pictures just of initially how it looked like. It wasn't an easy start. Like when you think about starting a business, you have to think about where is the money coming from? Where are you setting up the hospital or the clinic? And other things you don't even know, you get to find out later, like registration and licensing and all those requirements. So for us, despite the fact that we initially had this idea at the end of internship, it took almost a year after that for us to be able to start it. The reason being we had no funds, right? So you have to get money somewhere. And we needed to get loans in order for us to be able to start this. So back then, when you finish your internship, you were also immediately absorbed as an employee of the county. However, we did not have like permanent employment contracts. So we had to wait to get permanent employment contracts before the banks could give us loans. And then now we get the loans, everybody puts their money together, and then now we come up and use the funds to start the place. So after all that period of trying to get the money together, finally, we find a spot where we feel would be the right place to set up the clinic. We head over to the spot. The landlord decides to increase the rent by like 15% out of nowhere on that particular day. So we are back to square one. This thing is beyond our budget. We have to find a new spot. Takes us about another month to try and find a new spot. But funny enough, we're able to get an even better spot at a slightly lower cost than the additional 10%, but higher than our initial budget. And we started from there, with a smaller space and slowly just expanded. At that time, I was also doing locums at Aga Khan to try and make some money. And like the weird thing is that the Aga Khan was literally like 100 meters or 200 meters from where ASCA is set up. So not it took a very short time for the administration of the Aga Khan to realize that I was also working in Imara and quickly fire me from working there. And now I didn't have a extra source of income. The hospital, the clinic itself needed more money each and every month. So we were not making ends. So we needed to like pump in cash from our salary. So literally all my salary is going to the clinic. I don't have a source of locum, and I need to find time between working in the government hospital and working here. Those were like the toughest couple of months. I think the first 2 years was really tough because you basically eating githeri every day because that's what you can afford, not by choice, but hey, you have to do what you have to do. But 5 years later, a bit of success with setting up the clinic. We got good reception from the people there. We were offering care that was better than what they were receiving and more affordable than the competitors. And we were able to set up a big facility. This is what we were able to set up a couple of years later, right? So like to be exact, it took about 7.5 years for this to come up from when we started. Yeah, so that's a lot of sacrifice, that's a lot of time. And in that time, there's a lot of balancing that you need to do. Yeah, and for me, that was a lot of dreams have had to be given up. I had hoped to go back to my postgrad and finish my MEd in surgery a lot sooner, but that didn't happen. Yeah, so I actually got accepted to do my master's in surgery in Moi University, and literally went there for one day, and the clinic needed me back. At that point, we were having so much growth, and it just needed me to be there full time. So I went there for one day and booked a flight in the evening to come back. I went, did a deferral, and I wasn't able to go back after the deferral. So that ended. And that's part of even how come I came to think about having a different route to my master's and ended up coming to the UK, but that's a story for a later time. Yeah, so part of the things that I think have been very fruitful or motivational for me on a personal level is, you know, when you set up a facility or a business or a healthcare institution, you affect a lot of lives. And I've put the picture of this gentleman there because I think he's one of the guys that was really impacted by Imara, because he came in as a housekeeper. So when you see the picture on the right, he was a housekeeper. And the picture on the left, he was able to graduate as a dental assistant. So literally able to transform somebody's life from housekeeping to becoming a healthcare professional. And we've had a lot of people like who came in as receptionists who are now nurses. So what you do actually does affect lives of not just the patients that you're treating, but even the people who are working in your institution. Okay, so let me take a pause before going there. So in terms of my career planning, so as I mentioned previously, like I had taken a pause in terms of pursuing a career in surgery because I needed to manage the clinic and the hospital and to grow it to where it is right now. However, at some point I knew I had to go back into my training, and I had discussed this. I think one of the better things that happened is that I co-founded the institution with 4 other doctors, so we're 5 in total. And that gives space for succession as well as continuity of business. It's not dependent on one person. So that was helpful. In as much as I was a lead person for the beginning years, we had discussions that at some point I would like to go back and finish my education and my training. And as I was working there, I was part-time also doing like the UK exams. I was doing my master's. I did a master's in surgical sciences from University of Edinburgh, part-time as well. And I was still making time to go to theatre and keep my surgical skills up at the government hospital. So it's a life that's very stressful. Like you're literally up at 4 a.m. and you're going back to sleep at 11 p.m. I wouldn't advise it, but sometimes if you have big dreams and you only have 24 hours in a day, you just have to use the most of those hours to achieve what you want to achieve. Yeah. So last year, I stepped down at the beginning of the year from being the CEO. And at the same time that I stepped down from being the CEO of Imara, another opportunity opened up. That was Tibu Healthcare. They were looking for a chief medical officer, and I had met the CEO of Tibu through some social circles. And he called me up and we had a coffee, and he told me how he's looking for a chief medical officer. And I was like, yeah, this is quite a serendipitous situation, because at the same time, I was stepping down as CEO and had like a year before I transitioned to the UK. So it was like they had an interesting model in terms of something that I would be interested to do. I had always thought about digital healthcare and telemedicine and just delivering healthcare in a different way. And I thought this would be an interesting experience for myself. And they're looking for somebody who has my exact expertise. So I ended up joining Tibu as the Chief Medical Officer for a year as I transitioned between stepping down as the CEO of Imara and also stepping away from management into full-time clinical practice as what I'm doing at the moment. Some of the things that I'm proud of in between that we've been able to achieve. I got into Stanford Seed, which is Stanford Business School led program for high impact businesses. I was able to get into another program. What you see down there is INSEAD Business School, which is one of the top business schools in the world. They had a program for healthcare innovation. So again, with Imara, it opened some doors for me. Was able to do some program in Harvard Medical School as well for healthcare innovation. And down there was my recent graduation from University of Edinburgh with my MSc in surgical sciences. Yeah, but this is pretty much where I started back being a medical student. I was doing electives in India. That's where you see that. I got this picture from Facebook and I was reading my comments and honestly, nimetoka mbali. So I was in the same position that you guys are in. And it does take a while to like circle back and become the person that you're hoping to become. And sometimes like the dots don't connect and they don't make sense well, like you're on the journey, but at some point it does. And the most important thing for me is to remember like the end goal, have a goal in mind. And you may need to sacrifice a lot of your time in trying to achieve those things, but eventually, if you really want it, you'll get it. If you put your effort towards it and don't lose sight of what you're trying to achieve, you'll eventually get it. So for me, the reason that this could make sense is I initially started in clinical practice, wanting to become this doctor, then ended up realizing that maybe the thing for me might be management, and went into management for about 7 years and then came back and realized, okay, I'd like to be back in clinical practice. But I'm back in clinical practice with my eyes wide open. I understand that you can't fix healthcare from just one perspective. It's not management only, it's not clinical only, it's not academics. It's a combination of everything. And you have to be that holistic doctor who understands that at some points you have to be a manager. At some point, you need the academics, you need the papers, and you need to have that research hat and be that scientist. And you need to be a clinician, yeah, which is you interacting with a patient, keeping the patient safe, making their family happy, and ensuring that no harm comes to that patient. So maybe I've used too much time, but I'd like to finish with a parable that you can read up on a bit later, but it's called the parable of a wishing tree. It's about this poor man who is walking in sort of a desert and is sort of out of ends and ends up underneath a tree. And while he's underneath the tree, he just wishes, I wish I could have some water. And a glass of water turns up. So he drinks the water and he's like, wow, I wish I could have a meal. And a meal appears. So right now he's feeling lucky. He does not understand where or how all these things are happening, yeah? He eats the meal and he wishes for something else. It's like, I wish I could have a big estate, a big house with servants and everything. And the house comes. And he's very excited. He's like, okay, I think the only thing missing from this picture is I need to have somebody to share this with. So if I could have this intelligent woman who's beautiful and understands what I'm going through, that would be perfect. So he wishes for the woman and the woman appears. Yeah. And at this point, this guy is like, no way, this thing cannot be true. And he says, there's no way this thing is true. And everything disappears. And then he leaves. So the parable or the moral of the story is, you see, even where you are right now, there's somebody, or even you yourself have wished for what you have. But if you don't realize that what you have at the moment is something that you previously wanted and you worked hard for it, yeah, and somebody else aspires for it, you take it for granted and you might lose even that. So don't forget what you have, don't forget what you're working for, and never take anything for granted. The end.
Okay, thank you so much. Wow. Wow, I think we can definitely say that I think you started today's session on such a like surprisingly like relatable note, like despite the vast accomplishments that you've described. And even on that note, I'd just like to welcome like the over 100 people who have joined in since we started 20 minutes ago. I think Dr. Kirengo were usually told that like, are you surprised by this number?
Yeah, it's a big number. No, but I'm excited. I'd like to hear some of the questions guys might have, and yeah, just get into an engagement where we can chat, and I can try and answer some questions or have some provocations from everybody who's here.
And so I think what I even, just so that I don't use too much time, I just want to explain how we're going to do this. So first, we're going to do some pre-prepared questions, which were shared through the Google Forms via AMSUN. And then we'll open up the floor. Guys, please, first note, you can turn on your cameras if you want. Also note, you can unmute if you want, if you'd like to speak. We'll just do these 3 questions, and I've kind of ordered them almost in the as part like in chronology. So because it's nice to have that start that everyone can be able to see that you started with us. So just a quick run through of Doc's credentials. So he was a student at our university, and then he proceeded to do his internship. He proceeded to work in Embu, and throughout the past, I'd say 10 or so years, he's been in America, whether it's for an elective, like the way us, we just go for electives during our undergraduate, to going to boot camps in Stanford, in Harvard, and even, and all of this while he was working or being part of building the hospital that he described at the start, which is in Embu and is undoubtedly the best health center in Embu. And he's currently in the UK, where he's tuning in, where he was pursuing a master's in surgical science, and is now a member of the Royal College of Surgeons. Have I gotten that right, Dr. Tom? Have I?
Yeah, that's correct. Yeah.
All right. So here are the questions.
Mm-hmm.
Can everyone see? Can you see the questions?
Yeah, I can see the questions. I'm guessing everybody else can see them.
Okay. And so guys, feel free to comment when you see us on a question. Try and ask your question that's related to the one there, so that you can be able to make the most use of the time. So anything that's got to do with Doc's undergrad, this is a great time to make sure that those questions are done. So how did your university experience and tenure as AMSUN External Affairs Secretary in 2009 and 10 inform and shape your career choices and entrepreneurial endeavors? So I think this person is trying to figure out, from our humble corridors of Chiromo, how did you get into all these hobbies and start a cutting edge hospital?
Yeah, I think like being in external affairs, what it opened up for me, or what it made me realize, is that there's a whole entire world out there. You know, sometimes you're stuck in thinking, is University of Nairobi, and then there is Nairobi in general as like where the opportunity is, but there's a lot of opportunity first outside of Nairobi, still within Kenya, and there is a lot of opportunity outside of Kenya, like in the whole world in its entirety. So being in external affairs, part of the role in external affairs is to discuss partnerships, set up electives, and those type of engagements between students and different universities. Yeah, so I think for me, the importance of that particular stage in my career or life was just having the exposure at an early point and getting to see the variety of options that are there.
And what else? Maybe let me see. So someone is asking. Oh, okay, no, that one I think we can move on with it later. So unless someone has a question about Doc's undergraduate era, maybe then you can just leave it in the comment section. So let's move on to the next one. So Dr. Kirengo, as a successful surgeon and entrepreneur, how do you balance your commitments to your medical practice and your business ventures? And what advice do you have for those looking to pursue a similar dual career paths? Because you're a very accomplished surgeon, but you're also an accomplished entrepreneur.
Well, I guess finding the balance is a tricky bit. Yeah, like usually something gives. And for me, I think the sacrifice for a long time has been my personal life, which took the hit because, you know, each of these careers, a clinical practice and management, does take a lot of time. And it does take a while for you to become competent in either of them and gain the training that you need as well. So it's just making a decision. I think when you're a bit younger, it's easier for you to sacrifice your personal life as opposed to when you're older. So I'd say now is the time to endeavor in or try out whatever you want to experiment in while you're still young, while you can still like do those crazy hours that I used to do, like working 16 hours a day for weeks on end without getting any breaks. When you get older and you have family, it's difficult to do. When you have commitments, financial commitments, and otherwise, it's difficult to do. So start now. Start when you're younger, and understand that the balance is something that it's sort of you can never have a perfect balance. Yeah. So at times one thing will get the better as opposed to another time. But if you plan with the goal in mind as well, think about where you want to go and how all the dots connect, then eventually you can sacrifice some things for now and have them at a later point.
So basically what you're saying, it's been a journey of choosing what to focus on in particular seasons.
Yeah, exactly. Because you see, at the end of the day, you have an opportunity that's there in front of you at a particular time. For me, the opportunity was Imara, came first. I had at the same time an opportunity to go to University of Moi University to do my M.Med in surgery. However, I knew that if I was to leave the business or the organization at that time, we were not stable enough for us to be able to succeed or for it to be able to progress. So I made a decision, like despite the fact that I had school, I had been given study leave to go for school, it wasn't the right decision at that time. So I made the decision to leave that and figure out my surgical career later on. I am now back on a surgical path, full-time clinical practice, but this is like 5 years later than I would have.
And so just to even dig deeper into that, because actually that's even a comment that I had, and I hope it doesn't sound crass when it's coming out of my mouth to say that. The fact that you did so much, even like the boot camps, because those things like they take like a year, right? Like maybe the seed one,
Yeah.
The Harvard one,
Yeah.
or even just like the whole building a business and understanding the day-to-day and being immersed in that. I'd like to ask how you kept that clinical aspect of yourself alive and how it wasn't daunting for you to get back on track on that. And finally, do you think you're ever going to have to choose between the two parts?
Well, I hope I don't get to the point where I have to choose between the two, and I can give time to both of them in their own individual type of way. But I think in terms of getting to where I at some point just decided that clinical practice would take a pause. So I had clinical commitments, but my clinical commitments were part-time. And that was about 2 days in a week. Yeah. So if you're thinking about 2 days in a week for clinical practice, it's not too much, but it's enough for you not to become rusty. So what I needed was just enough for me not to lose my skill, to maintain knowledge. And that's what I did. So I took the minimum that I could of clinical practice and spent the rest of time in the management space. Right now, it's sort of flipped because I am spending most of my time in clinical practice and very little in management. So it just depends on where you are at what particular time and what your options are at that particular point. So I think, you know, like at the time that I was making this decision, most of the guys, my friends and guys who were in medical school with, everybody was doing their masters, and now everybody's like a consultant or whatever from the masters that they did. And you can feel like you've made the wrong decision, but still, even those guys who have their masters, some of them come to me, some of them are dropping off, like they don't want to do clinical practice anymore after years of pursuing a master's. Some of them are trying to relocate countries and are asking me, how do I get to become a doctor in the UK? And does my master's from Kenya matter when I come there or whatever? Some of them are trying to open clinical practices and hospitals and don't have the competency for it. So it's just, everybody has a different journey and it's a different timing for each and everyone. I can't say that I made the right decision, or I can't say that somebody else made the wrong decision. It's just making a decision with the opportunities that are available to you at that particular point, and understanding as well, what do you want to achieve at the end of the day? Because you need to have some motivation, and the motivation shouldn't just be something like, I want to make money. Like, do you have a motivation beyond finances? Because if you're to be financially stable doing either thing, then what would you want to do?
And thank you for that. I'll even use that as a segue to address some of the questions coming in the comments. And by the way, guys, we're not going to leave here without, or at least utilize the time without getting as many of your questions. So if you see like I might be ignoring your questions, repost it, harass me. So someone here has asked, did you have a mentor guiding you through your undergraduate program? And like, so I'll even extend that question to asking you, in making these decisions of knowing where to be and what to do, what to sacrifice, what not to sacrifice, what has been your guiding force, other than you saying that those are the things that you want? And would you say that there were people who helped you make those decisions? And so that's that part on the mentorship, because it was also in the forms. I'd also like to ask you, like, for some of us might have parents, or even we speak to certain mentors and they're just like, hey, listen, relax, just go read, practice. Mambo mingi, he wants to be a good doctor. So what do you have to say to that kind of narrative?
Yeah, I can say finding mentorship is a difficult thing, especially like in med school. I don't think I had anyone in particular that I would say was a mentor per se. Post medical school, like when I started internship, and I worked in the surgical department, I think one of the things that was really helpful for me is we had one of our, I'll say not even one, two of the consultants who ran the surgical department were really strong in mentorship and in guidance towards a surgical career. But they were open enough to understand that there are other routes as well. So these are guys who I could like openly approach and talk to and tell them about plans outside of surgery and other things that I wanted to pursue. And they would be more of a sounding board, just checking in with seeing whether you are fine with your own decision, not them guiding you towards what they think is good for you, but them like sort of helping you make a decision that you're comfortable with for yourself. And I find it sometimes difficult in our space, in our Kenyan space, to find good mentors, because you find like either you're not clicking in terms of guys are not understanding what you're going through, what you're trying to explain, or you find that somebody is sort of guiding you towards their path rather than what you want to do. So for me, one of the things that really worked was I got mentors from different spaces. I've had mentors in business who are completely business people, like with no clinical experience at all. I've had mentors who are completely clinical. I have never had a mentor who's been in both spaces. And both these two different minds like think very differently about life. And they advise you and help you come up with a better decision, but you are the one coming up with the decision. Your mentor isn't meant to give you like a cheat sheet for life. They're just supposed to sort of help you avoid making some common mistakes that you would or they have made. But at the end of the day, you're responsible for the decisions that you make. And finding mentors, especially in different spaces, has been one of those journeys in reaching out to people. Like, it's a very uncomfortable thing where you reach out to people who you don't even know, and some of them literally just like give you a slap in the face. Like, they don't respond or respond in a negative way, and you are having this guy that you put in such a high rank, and they shut you down and you feel bad about it. But there are other people who you would not even expect. Like, you would think this person is the CEO of like a huge organization and they wouldn't have time for you, but funny enough, you find that person has time for you. And you build a relationship with them. So I guess it's you being able to have the courage to reach out to people and not stop when you get like shut down or the door closed on you, and you'll find somebody who clicks with you. And understanding that the mentorship as well is different stages need different mentors. So you don't have one mentor for life. You have different mentors for different things that you're trying to do. And as well, that comes to an end and you need to find a new one, and recognizing when one relationship has come to an end and you need to find a new one, and just having the courage to try and find someone.
Okay, that's excellent. Sorry, I noticed that this stopped being shared. So thank you for those wise words on mentorship. And guys, even during this fireside chat, people have been getting hooked up or being plugged with people who can guide them. So maybe later on you can guys can just declare that, and then Doc maybe some people who have some ideas of where they'd want to be or where they'd want to go, because some mentors have been sharing different people and guiding students to different people. So so the questions are getting quite spicy in the comments. I don't know if you've had a peek.
No, I haven't had a chance to look at the comments. Sorry.
So before we go deep into the hospital related questions, because we've been asking you about how you've been balancing. There's a very spicy anonymous question that's been asked here, or maybe I'll leave that for later and just give people some suspense. I think for your own security, Doc, I might excuse you from asking the question on how much money do you make per year? Roughly per year. So I leave that to your discretion. We can that person.
That's a difficult question for everybody to answer. You know, finances are a private thing, but
yeah. And
yeah, so I'll just skip that question.
Pole to that person. So give your experience as a former chief medical officer. Okay, Tibu Health and a co-founder of Imara Hospital. What do you believe the key factors that contribute to the success of a healthcare startup in today's competitive landscape? And yeah, so it's because there were a couple of questions related to that. So this is what are the key factors that contribute to the success of a healthcare startup today? And then here are all the other questions that have to do with the pros and cons of owning a clinic, and got to do with the team that you got together and the financial capacity that you built. And would you advise someone to go on this path?
Okay, I think those are very difficult questions and things that I may not be able to answer. Like, would I advise somebody going to that path? You see, at the end of the day, it depends on how committed you are. And when it comes to, okay, so let me step back and go to the question of what is a key success factor in a startup or in anything. And I think it starts with, first, do you understand your customer? Like, what is a problem that you're trying to solve? And is there anybody else trying to solve it? So what makes you different in how you're doing it? Because at the end of the day, when it comes to healthcare, we're all trying to serve patients. And like, for example, if you're opening a hospital, is there another hospital there? And if there is, or there are many other hospitals, what are you doing different from those other hospitals? Why would a patient come to you and not go to the other one? Right? That's number one. So what's your value proposition to the patient, to the customer, that would make them come to you rather than go to anybody else? Is there anything that's innovative in how you provide your services? Second is, who's your team? Right? Because you might have like a very good value proposition, but even you yourself as being part of the team, you're not committed to what you're trying to do, right? So giving the example of myself and my career, like at some point I had to leave or stop going into my master's to come back to continue running the organization, because that's what the organization needed. Are you able to make that type of decision? Are you able to be committed enough to say, I'll sacrifice something that I feel is an opportunity and focus on this for now, because if I do not, it's not going to succeed. And you might not be in a position that your business is able to hire somebody else or get somebody who has a similar commitment to you or sees things in your perspective and is able to drive your business or your startup in that particular direction. So commitment starts with you and the rest of the founding team or the initial team that you have. If you do not have that team, if you do not have a value proposition, then there's no point in getting started, because you're not going to end up anywhere. Those are the two essential factors that you need, because if you have a right team, you can always pivot. You can always like get a new idea, change your business into something else. If everybody's there and they have their skin in the game and they're committed and understands this, then successful business.
And so there were quite a lot, even in our current chats on your journey of starting a hostel. In fact, there was someone who had asked, okay, maybe what we can jump to, if unless someone wants something clarified on the, okay, when did you build the current hospital complex? And how was the previous hospital structured? Did you just start with a simple setup, and how long did it take to upgrade?
So
what are the reasons?
Yeah, I think I mentioned a bit about this. So ASCA started with a clinic back in 2015, July 2015, and that clinic was premised in a rental building, and we were occupying half of a floor. But we slowly grew and expanded. So it's not like you have the financial capacity to just put in all your money and build a big hospital to begin with. You start with what you have. If you have enough capital to just set up like what we did, which was in half of a floor space, then you start with that. By the time that we were building the hospital, us guys were occupying how many floors? About 4 floors in that same building. So we started with quarter or half of a floor into occupying 4 full floors of the same building. So you start with what you have, minimum needed for you to be able to see whether you're able to succeed, and keep doing what you're doing and growing your business until you're able to grow into something bigger.
And so now the next question, which a lot of it has to do with your path to the UK. So what are the requirements to work in the UK as a doctor, or even do your master's in the UK? And somebody went the painstaking effort of saying in a step-by-step manner, what are the requirements for setting up a private practice in Kenya? So maybe you can describe practice in the UK and also practice in Kenya.
Okay, I think let me mention the easier one, like the setting up a clinic, like let's say a clinic in Kenya isn't really that difficult. Then not too many requirements. You need to have like a business that's registered, so either register a business name or register a company. You need to have like a medical doctor or a clinical officer who's going to be the superintendent of that facility. And then you need to have, like, if you go to the website for KMPDC, they have a list of everything that you need to do. So it's pretty simple. It's something that you can download online. So you don't need, we don't need to get into detail in how to do it. So it's available online.
Okay, yeah. And now for building up to being able to being a practicing doctor in the UK, because there's questions on that also.
Yeah, I think.
Yeah. Okay.
Okay, excellent. Let's talk about practicing in the UK. There are a couple of different pathways to get here. I think the 2 main pathways that guys understand is, one is a specialized pathway, which is what I'm on, or a non-specialized pathway, which is what guys get into when you have just finished med school or have just finished your internship and you have no specialist experience. And with that pathway, you would need to do PLAB exams. So there's a PLAB 1 and a PLAB 2, and after doing your PLAB exams, you can get registered as a doctor with the GMC, which is the General Medical Council of the UK. And after registration with the General Medical Council of the UK, you can apply for a job, and that's how you get into the system. So that's one way for junior doctors who would really have, who have just finished internship, or you just finished med school and you haven't really practiced. The second way is through the specialized route. So a specialized route depends on which specialty you're in. So there are different royal colleges for different specialties. Like for surgery, we have the Royal College of Surgery. For physicians, there is an equivalent college for each one of them: obstetrics and gynecology, etc. So each of those colleges have examinations, specialized examinations for membership or for fellowship. So you have to start with a membership examination into that college. And once you pass the membership examination, usually there are 2 or 3 exams, written exams and a clinical examination. Once you pass those exams, then you are also able to register as a doctor through the General Medical Council. So those are the 2 main routes.
And so some people would like some more, because we noticed you did an MSc in Edinburgh,
yeah.
2019 to 2022 as a Commonwealth scholar. So someone wanted to ask how that course was. Was it purely online, modular? How did it work?
Yeah, so for the University of Edinburgh course they have a couple of courses in different specialities, not just surgical sciences. They have some in family medicine, internal medicine, etc. The good thing with the courses is that you're able to do them as long as you are working in a hospital in your particular specialty. If you're an emergency doctor, you're working in emergency medicine or ED. If you're in surgery, you're working in the surgical department. They're all completely online, so you're able to do it online. And the good thing with those exams, the masters, is that they prepare you for the membership exams to the different royal colleges. So like the one that I did was basically in preparation to become a member of the Royal College of Surgery, and the exams are pretty much easier after you've done the masters. So it's an option for somebody to do, and the scholarships, there are a lot of scholarships available, including the Commonwealth Scholarship. So this is something that someone can pursue if they have recently finished or graduated from undergrad, and they're looking for something in the meantime in preparation for them to be able to like shift practice from Kenya to the UK or elsewhere.
Wow, that's amazing. So you, like just even so for people who might not know, the University of Edinburgh is part of the Russell Group, which is essentially the Ivy League in the UK. So because Ivy League of America was not enough, you also went to the Russell Group in the UK. And yeah, that's a really, I didn't even know that it's possible to do a course remotely, but it's also being certified by the fact that you're also working here locally at the same time. And so even
so that's an opportunity, like, because Commonwealth scholarships are available for a lot of the courses that they have at University of Edinburgh. So this is something that guys can do when you finish your internship. You're not doing anything, or you're thinking about what's the next steps in your career. Your county is not releasing you to go and study. You finish, you can spend that time doing this master's part-time. You finish your master's, do a membership exam into one of the royal colleges in the UK, and from there you can get registration and continue your practice or your specialization.
And so even to clarify someone's question here, the difference between an MEd in surgery and this MSc in surgical sciences, and just clarify if you needed to do PLABs. Okay. Yeah. So
first and foremost, PLABs is completely different. So PLABs is not a specialist exam. PLABs is a registration or a recognition as a doctor in the UK. So if you would like to be recognized, you finished medicine in Kenya, for example, and you're not a member of any of the royal colleges, then you'd need to do an examination that is recognized so that they can recognize your qualification as a doctor. And that's where PLAB comes in. So it has no value other than that, than recognition as a doctor in the UK. There's no other value to it. Next is, sorry, what was the next question? It was sort of tied together.
They asked the main difference between the MSc surgical science and MEd.
Oh yeah, so they're completely different things. So MEd does not, okay, so in the UK pathway of training, there is no equivalent to MEd. It does not exist in UK or in Europe in general. So MEd is pretty much designed as a university course into specialization. However, how specialization is done in the UK is usually through hospital, they call it deanery, but through hospital group trainings, where you have a curriculum and you have competencies that you need to acquire during a certain time period. And what they check is your logbook for acquisition of those competencies. And then you have the royal colleges that administer exams to confirm whether you have like sort of achieved a certain level. So there is really no equivalent to MEd. When it comes to the MScs are how doctors work here is you're either an academic doctor or a clinical doctor. So the MScs are more of academic in terms of they give you more knowledge and they give you research experience and background, which is useful, but not really a requirement. So many doctors here do not have like masters or any training, even if they're specialists beyond their university, like undergrad degree.
Okay, thank you for clarifying that. And the final question for these academic or UK questions, how long do you have to practice in order to become a member of the Royal College of Surgeons?
Yeah, you don't really have a time limit that you need to practice. You just need to be able to pass the exams. So, however, in order for you to be able to pass the exams, there's some competencies that you need to have. In order for you to acquire those competencies, I'd say you need to, like, for example, the surgical one, you need to have worked in a surgical unit for a minimum of 2 years. It'll be very difficult for you to be able to pass the exams if you haven't. So by default, how the exam itself is designed, you will not be able to pass the exam if you do not have competencies that you need to acquire while working in that particular specialty.
All right, thank you. So just some questions, I guess like now more broad questions about your journey so far and how your career is progressing. Sorry, I had just seen that question. What would you advise someone in the technical space, like computer science, who wants to integrate it in medicine? So someone has asked that.
Okay, I guess like, are they a medic or are they like completely in computer science?
From our perspective as medical students.
Okay, because, you know, like healthcare, one of the things I like about healthcare or like the medicine degree, I feel it's one of the broadest degrees because it can be plugged in anywhere. You can plug it into business, can plug it into IT, because there are a lot of problems in healthcare. When it comes to the IT systems we're using, we need people who are fixing the IT problems there. When it comes to management as well, we need people who have clinical background or medical knowledge who are fixing issues there. So it's just about, do you want to pursue a career in IT? Do you think that would be satisfactory for you in terms of the long term? And whether that's going to be sustainable, or would you get bored at some point? I guess that's a bigger question, but in terms of applicability, you can apply it in pretty much everything.
And so why I even imagine this person had also asked you, and even your history of having done the SEED program, what would you say, and even by the way, guys, Imara Hospital in Embu has a very wonderful social media presence, a very beautiful hostel. For those of you who didn't see it, let me just post it. That's the hostel, which was the brainchild of Dr. Kirengo and his peers. And so I think in one of the YouTube videos you had mentioned that this is a business, or not a business, like it's an entity which aims to influence and impact and be a leader even in Africa. So what are your thoughts on like our opportunities here, even as we talk about going to the UK?
Yeah, so I think there are a lot of opportunities in Kenya. First, like for me, when I went to the county to begin with, when I went to Embu, I did not intend to stay in Embu for as long as I did. I was there for 10 years. I thought I'd be there for 1 year, do my internship, get back to Nairobi, back to the city life and everything. But that all changed when I went there and saw like the needs that were there. Because like we said, the first thing, if you're trying to start a business, startup, whatever it is you want to understand where the opportunity is or what the problems are you're trying to solve. So definitely there was a problem there that needed solving. Like there were no private facilities, healthcare facilities, and if there were, they were too expensive, or they're not expensive, but the quality of care is compromised. It's not as good. So it's just keeping your eyes open, seeing where an opportunity lies. Are there collaborations that you could do? I know in Tibu, for example, we were hiring doctors. So there are opportunities even in companies that are not doing your typical day medicine, where you could think about starting a career there. Yeah. So you don't have to think about just joining a county, joining MOH. Think about other companies where you could gain some experience or even work.
So before we get to I'm saving the spicy one for last, guys. Just this last one that has come in with concern to your work, what challenges have you faced as a clinician in the UK? And just to give you a warning for the next one, there's someone here who has said, please say something about your family, doc, and then I'll read the spicy question after.
Okay. So I'd say I'm pretty new to the UK. So it's like I came here in mid-Feb, so I've just transitioned. I left Imara, or I was transitioning out of Imara from end of Feb last year, and I had a year break before I came here. So I am experiencing challenges as I go. I think the major thing for me right now is I'm here alone. So being away from family, being away from a culture that I'm used to is different. The weather is different. The people are different. The healthcare system is completely different. How they do things, how they talk, focus on, like the focus in the hospital is different. The roles, like, how do I give a simple example? So in terms of how we communicate with the patients, the patient is a bit more empowered, and our communication is always towards patient safety. So you have to ensure you have explained a lot more to your patients. We document a lot more. There's a lot more paperwork that we do here. The role of the consultant is a bit more engaged because, like I said, the one that I joined in as an intern, the previous interns left, and that's a healthcare risk. Like you've left a junior intern who's in day one to manage a unit without any supervision. Over here, the consultants are a bit more involved because they're accountable at the end of the day, and everybody is there to support you. You'll not do anything that you're not comfortable with. They will not let you do it. And if you say you're not comfortable with something, somebody else will come and do it, right? So you do not have those situations where you're put on the spot and you're doing things that are beyond your competency or beyond your comfort zone, which is something that we do a lot of times in Kenya. And your superiors or your supervisor or the person who's supposed to be assisting you just cannot be found.
Thank you for illustrating those difficulties and those silver linings. And now, for what I'd assume, the spicy questions people must always ask. In fact, this one is going way back into the archives of school, and it's anonymous. Ask him this one. Did you get into a relationship while you were in medical school? How soon would you advise a medical student to get into a serious relationship? So I think.
Well, I guess it's different for everyone. I had my own number of failed relationships when I was in medical school. I think it's part of the reason I chose not to date a doctor after med school. So so my wife is in a completely different career, but I guess it's different for everyone. I have guys who like got into very serious relationships, ended up getting married, and they were dating from med school. I have people who were dating from med school and broke up and ended up with completely different people. And there are guys who got into relationships and got married, the first ones, and now they're the most single people ever. So it's a different journey for different people. As long as you have the right person and you're doing it for the right reasons, then it usually tends to work out at the end of it.
Okay, so how has maintaining like even your friendships, even your networks, because you've been very itinerant and also very occupied with engrossing activities. How has that been, and what would be your advice on that?
Yeah, that's actually a very important question, because I feel like at times we one of the disadvantages of the career that we're in is that it feels like it's a very narrow path, in that you finish med school, and after med school you become a specialist. Then after specialist you start a private practice, and if you deviate from that path, you are uncertain of whether you're doing the right thing or not. Yeah. The second thing is, as time goes by, the differences between you and the group that you started with. So you graduate as a class, all of you go into internship. And then from that point, guys start taking different paths. The guys who go into academia immediately, the guys who get into the UN and start earning $1 million bob, and the guys who don't get jobs. And maybe you are like the top of your class and you're not getting a job and you get depressed. An important thing is maintaining, which is, I'm lucky to have a small group of friends who we've stayed close ever since the beginning. So maintaining close relationship with, you don't need to have a big circle of friends, but a small group of friends. There's a big influence in they say the top 5 people you spend most of your time with have a big influence on you, and that's evident even from like study groups. When you're in a certain study group with guys who are on point, you are sort of in a situation where you can't fail, because even if you're at the lowest level of that group of high-performing 5 people, you are in a good spot. Yeah. So just maintaining a high level of friendship that keeps each other accountable. If you see somebody sleeping, you're able to direct them and tell them straight up, you're not headed in the right direction. How can we assist, etc., and helping each other, because today you might be the one who doesn't have a job. Kesha could be somebody else. For me, I've had a tight group of friends ever since med school, and we've kept contact. We meet frequently. We have WhatsApp groups and we talk all the time. And everybody, I'd say, is in a good place. And that's because we've been able to hold each other's hands through good and bad times. I've had my share of losses. I've had friends who've passed away because of drugs, alcohol. This is something that is bound to happen even with you guys. So I wish we saw the signs a bit earlier. So just keep watch of your close friends.
Wow, that has taken quite a deep plunge. And so what I would ask, I think it's actually important to ask about that last point that you've mentioned, how to keep tabs and appropriately support each other, despite how many things change. What's maybe an insight you can share about that from your own experience of what you could have seen earlier, what could have been done?
Yeah, the tough thing is, like I said, you finish school, you have, let's say, a group of 5 friends. Maybe 4 of you get good jobs, 1 person does not. And suddenly you guys are always chatting on WhatsApp groups. The 1 person is silent. When you're meeting up, the person is not there in the meetups. These are some of the red flags that tell you that probably there's something going wrong with this person. Maybe their personality seems to be changing. They seem to be closing off. There's somebody who was previously very open and extroverted, suddenly has become very intro. They're not posting on social media anymore. And yeah, the best thing is to try and just act as early as possible as a group of friends when you start noticing that such a thing is happening to any one of you, because it could be anyone, you never know. Yeah. And reaching out to them at the earliest point when you notice this change is beginning to happen.
All right, thank you for that, Doc. And so because our time together is has arrived, I mean, our time has come to an end. In closing, thank you so much for making it so holistic and even just sharing on that, and just your vision, what you have managed to do for yourself through these corporations and this corporation of Imara, and even now your current journey as a surgeon, and even allowing us privy into just your thoughts, even just on relationships and friendship. And yeah, because the whole point of these talks is for it to be as holistic as possible. There are two questions here that weren't addressed, that had to do with venture capitalism playing a role in the expansion of Imara, and one on just a moment, like how this hostel complex was built. But I think actually, you had answered that. So I think maybe you can share social media, and then maybe you can talk with those people more on that. I'd just like to call Ntusi to do the vote of thanks, as this is the brainchild of the current AMSUN committee. And so, yeah, let's invite him.
Maybe just one final comment to address a question about VC and funding. So I've worked for two different organizations that have completely different models in funding. So in Imara, ASCAS was self-funded. We do not have any external capital. And Tibu, for example, which is a different company that I've worked with, and that has VC and external capital that has been used in funding. So it just depends. There are different ways of funding organizations, but at the end of the day, regardless of whether you get VC funding or you internally fund your own organization or whichever startup you're planning to do, when you're starting it, you will have to have money yourself. You'll have to find the finances to begin and show that there's success before anybody else can come in and put money behind what you're doing. And probably a final comment before Ndusi comes in is, I think one of the things that I learned in the last 10 years that I feel is important for everybody to understand is that failure is something that will happen. Even with Imara, we've had our own share of failures. Personally, in terms of the things that I have done, I have failed in a lot of things. We talk about the successes, we hardly talk about the failures. So just know that behind all this success or seeming success, there is a lot of failure that has happened behind it, and that failure has been used as fuel for future success. And if you find yourself in a situation where you feel that you're not achieving what you've set out, and you feel like you're failing at times, just know that's part of the process. Yeah, and if you really want it, you keep working on it, and eventually you will succeed.
Thank you. I think you can have right of reply to all those profound words.
Thank you, Dr. Kirengo. I know we're a bit time pressed, but there's just one question that we've spoken about before. I think it somehow slipped through the cracks. And it's about books. You mentioned how books have been instrumental in basically shaping your mindset over the years. And my question is, well, in line with that, like which books would you say have basically resonated with you the most over the years? Like sometimes it's different because, okay.
It's an important question. I think for me, currently, what's most influential to me, and as much as books have been a big influence for me for a big part of my life, I feel like the world has changed a bit, and my influence right now is drawn from a different direction, which is mainly from podcasts. I'd say on the book space, I've been two books that have really inspired me, and it's because of the storytelling. Like I mentioned to you before, is Alchemist and Richest Man in Babylon has very good storytelling, but a moral inside the story. However, my current thinking is hugely shaped by some podcasts that I listen to. I can send you a list of those podcasts. Most of them are business and not completely non-medical. I listen to very little medical podcasts, but I feel like it does offer like a wide range of thought-provoking context. Like two of them, one is called The Knowledge Project. Another one is, I listened to Andrew Huberman, who is like a PhD neuroscientist from Stanford, talks about a lot about health and health improvement. Knowledge Project talks about, they interview different people, CEOs or high performers in different things, and just try and deconstruct how they think about things. Another interesting one would be, there's a couple of them from Harvard Business School that have different business case studies, and they try to talk about, like, break down the case studies. So I can share them with you. I can share a full list of them with you, and yeah, hopefully they're useful to the guys who've attended.
Thank you. So I guess we've come to the tail end of our session. I'd like to thank Nikhil for doing the excellent, wow, I mean, such an excellent job at this. I mean, you've made this webinar to be quite interactive and fun and energetic. And also to you, Dr. Kirengo, thank you so much for making the time and also delving deep into your personal story. I feel like your storytelling was quite compelling. It made us feel like we connected with you, you know, like in the process. And also the photos played an interesting role in doing that. I'd also like to thank everyone for joining this session. We could be doing many other things given that it's 8 p.m. and it's actually spilled over to 9:20 now. But I think what we've gained from this session is quite impactful and meaningful. And it'll actually be instrumental in shaping our life goals. Because one of the things that you mentioned is that things might not be clear, like from the outset, but sometimes you just need to take leaps of faith, you know, trust our guts, and then maybe we look back 10 years from now and connect the dots. So that's all I had to say. And thank you. Thank you.
Yeah, thanks for inviting me. Thank you guys for showing up. It was a big crowd. I didn't get to read the comments, unfortunately. But yeah, thanks to everybody for your participation and staying up this late.
And so we usually have a tradition at the end of the physical and also the online business forums. We already have our cameras on, so selfie. So we just like, Felix on the beat. It was a say no more. It came on. Please, guys. Because I'm hearing that people here who have been recently left, this is your place to broadcast yourself. You know, be seen, be in the arena. You never know who might see you here. And yeah, so I just want to ask guys to, even for those who are leaving, can leave a comment. I'm just waiting for a nice forum for the cameras. It's okay, watu wale wako na kitambaa. It's 9 p.m. Don't worry. Oh, hey, Cynthia, madam. Kuvuki, thank you. Kenya, thank you, Ian. Hey, Joy. Hey, Lavender. Yeah, thanks, guys. This is awesome. Just waiting for the final, guys. And Dokia, people are saying thank you. Someone is asking for you to repost the podcast that you mentioned. So maybe
yeah, I'll send them to Lucy. I'll send like a list of stuff.
That's awesome. All right.
Yeah, as well as my social media is LinkedIn is my preferred social media for connection. My Instagram is a bit more private, but yeah, LinkedIn, we can talk anytime.
No problem. Yeah, people are just saying it's been amazing. So let me just get that screenshot. Okay, so when I say AMSUN, just please have a smile on your face, or the disposition you don't mind being immortalized. So just a moment. So AMSUN. Awesome. That's one. Let me just get a second one for the road. AMSUN. Excellent. All right then, guys.
All right, cheers, guys. Thank you. Have a good night.
Good night. Thank you guys for coming. Good night.